The male hormone testosterone, it's a term that frequently inspires thoughts of strength, power, and masculinity, but there's so much more to this important hormone than meets the eye. It's a term commonly linked with masculinity, and for good reason. Testosterone is responsible for many of the physical attributes that distinguish masculine characteristics such as muscular bulk, body hair, and a deeper voice. But its relevance extends much beyond that. This hormone is vital for sustaining general health and well-being in males. It impacts everything from bone density to red blood cell formation. This hormone plays a key function in men's general health and well-being. Regular exercise and a balanced diet may help maintain healthy testosterone levels, but sometimes that's not enough. From growing muscle and raising energy levels to affecting mood and sexual desire, testosterone is a critical component. It makes males feel powerful, active, and confident. Testosterone is a significant factor in many facets of life. It may increase physical performance, improve mental clarity, and even contribute to a higher quality of sleep. But what happens when your testosterone levels take a dip? You can start to feel less like yourself, your energy levels may dip, and you could find it tougher to remain focused. You can feel changes in your body and mind that are minor at first, but grow more harder to ignore. Fatigue, despair, and a reduction in muscle mass are just a few of the symptoms. These changes might signify a common illness known as low testosterone, commonly known as low T. It's a problem that affects millions of men, sometimes without them ever recognizing it. Recognizing the indications is the first step toward taking back control of your health. If you feel you have low T, it's crucial to visit a healthcare practitioner for correct diagnosis and treatment. In this video, we'll look into the symptoms, causes, and cures for low testosterone, giving you with the information you need to make educated choices about your health, allowing you to live your life to the fullest. And with the correct knowledge and assistance, you can regulate your testosterone levels and live a healthier, more vibrant life. One of the most prevalent indicators of insufficient testosterone is chronic weariness. This isn't simply the occasional exhaustion we all experience after a long day or a terrible night's sleep. It's a profound, unending tiredness that seems to follow you everywhere, no matter how much rest you receive. You wake up feeling fatigued even after a full night's sleep. It's as if your body hasn't completely recharged, leaving you dragging your feet from the time you get out of bed. You find it hard to gather the energy to get through the day, much alone indulge in physical activities you formerly liked. Tasks that used to be easy suddenly seem like climbing a mountain. Even the concept of exercising or indulging in hobbies might seem daunting. This persistent exhaustion may permeate into every part of your life, hurting your career, relationships, and general quality of life. It may make you less productive at work, less present with your family, and less interested in social activities. The excitement and passion you once had for life might start to disappear. But exhaustion isn't necessarily an indicator of age or stress. While it's true that our energy levels might diminish as we grow older, and stress can surely take its toll, chronic weariness is another beast entirely. While these variables might contribute to exhaustion, persistent, unexplained fatigue should never be overlooked. It's your body's way of warning you that something is amiss. Ignoring these indications might lead to more significant health difficulties down the future. It might be your body's way of indicating that anything is awry, and low testosterone could be the reason. Low testosterone may impair your energy levels, emotions, and general feeling of well-being. It's vital to listen to your body and seek medical assistance if you sense anything is awry. If you find yourself continuously reaching for that extra cup of coffee or battling to remain awake throughout the day, it's time to pay attention to what your body is trying to tell you. Don't simply put it up to growing older or being stressed. Persistent weariness is a symptom that something needs to be addressed. Talk to your doctor about your symptoms and examine the possibility of low testosterone. Taking action now may help you restore your energy and enhance your quality of life. Have you noticed that your clothing fit differently lately? Perhaps your muscles seem less defined, or you're gaining weight, especially around your waist, despite no substantial changes in your diet or workout program. These alterations in body composition might be red flags for low testosterone. Testosterone serves a critical function in creating and maintaining muscular mass. When your testosterone levels diminish, your body may struggle to hang on to muscle, resulting to reduced strength and greater fat accumulation. This may culminate in a condition known as sarcopenia, characterized by age-related muscle loss. If you're suffering unexplained muscle loss or weight gain, especially around the abdomen, it's crucial to visit a healthcare expert. Low testosterone doesn't simply appear physiologically, it may also dramatically impair your mental well-being. You can find yourself on an emotional roller coaster, experiencing mood swings, anger, and even signs of depression. These emotional shifts may strain relationships, making it hard to connect with loved ones. It's vital to remember that everyone has periodic mood changes. However, if you observe a persistent change in your mental state marked by increased anger, depression, or a lack of drive, it's crucial to seek professional help. Addressing the underlying hormone imbalance might be the key to recovering emotional stability and enhancing your general quality of life. Let's speak about a delicate yet vital element of men's health: sexual well-being. Low testosterone may dramatically affect your desire and sexual performance. You can sense a lessened desire for closeness, difficulty obtaining or keeping an erection, or even changes in your sleep habits. These changes may be extremely stressful, affecting your self-image and personal connections. It's vital to handle this matter with care and understanding, you both for yourself and your spouse. Open discussion with your spouse and a trusted healthcare expert is crucial in addressing these problems and finding the best way toward recovering closeness and contentment in your relationship. Now that we've covered the basic indicators of low testosterone, let's look into the causes that might lead to this hormonal drop. Age is a natural component. Testosterone levels steadily fall as men age, often beginning in their 30s. However, other factors might hasten this reduction, including certain medical disorders, including lifestyle choices and drugs, illnesses like obesity, type 2 diabetes, and sleep apnea all disturb hormone balance and contribute to reduced testosterone levels. Similarly, lifestyle variables including chronic stress, lack of physical exercise, poor food, and insufficient sleep may significantly affect testosterone production. It's necessary to use a comprehensive strategy to address these underlying problems and encourage healthy testosterone levels. I suspect you could be battling with low testosterone. The first step is to visit a healthcare practitioner. They will do a full examination, taking into consideration your medical history, symptoms, and lifestyle variables. A simple blood test, generally conducted in the morning when testosterone levels are greatest, may correctly evaluate your testosterone levels based on the findings and your overall health profile. Your doctor will propose a comprehensive treatment plan suited to your individual requirements. Remember, self-treatment is never advised. Seeking expert help ensures you obtain correct diagnosis, safe treatment choices, and regular monitoring to manage your disease efficiently. While medical intervention may be required in certain circumstances, you can take important efforts to naturally enhance your testosterone levels. Understanding the significance of these adjustments is the first step towards a healthy you. The lifestyle adjustments have a key part in regulating hormone balance and increasing your general well-being. These modifications are not only about raising testosterone, but also about improving your quality of life. Start by introducing regular physical exercise into your regimen. Physical exercise is a cornerstone of a healthy lifestyle and has a dramatic influence on your hormonal health. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking or cycling most days of the week. Consistency is crucial, and even tiny amounts of daily activity may make a major effect over time. Strength training activities in particular have been demonstrated to be useful in raising testosterone levels. These activities assist develop muscular mass, which in turn helps boost your body's capacity to create testosterone. Focus on complicated motions that work for numerous muscular groups simultaneously. Such include squats, deadlifts, and push-ups. These workouts not only enhance strength, but also promote the synthesis of growth hormones. In addition to exercising, emphasize obtaining 7 to 8 hours of decent sleep every night. Sleep is when your body repairs and regenerates, and it is vital for maintaining appropriate hormone levels. Managing stress via relaxation practices like yoga or meditation is also vital. Chronic stress may lead to high levels of cortisol, a hormone that can adversely affect testosterone synthesis. Maintaining a healthy weight with a balanced diet rich in fruits, vegetables, lean protein, and healthy fats is another key component. Nutrient-rich meals give the vitamins and minerals essential for hormone synthesis and general wellness. Staying hydrated is sometimes ignored, yet is crucial for your body's optimum functioning. Water aids in the delivery of nutrients and the disposal of pollutants, both of which are vital for maintaining hormonal balance. Social interactions and sustaining good relationships may also favorably affect your hormone levels. Engaging in social activities may relieve stress and enhance your general mood, which in turn may maintain healthy testosterone levels. Avoiding processed meals and excessive sugar is key. These may lead to weight gain and insulin resistance, both of which can significantly affect your testosterone levels. Finally, spending time outside and receiving some sunshine will help improve your vitamin D levels, which is connected to testosterone production. Even a brief stroll outdoors may make a difference. By adopting these lifestyle adjustments, you can take ownership of your health and boost your testosterone levels naturally. Remember, it's about building a sustainable and balanced approach to your well-being. Low testosterone is a common problem, but it doesn't have to dictate your life. By knowing the symptoms, causes, and treatment choices available, you may take proactive efforts to manage your illness and restore your vigor. Remember, obtaining expert help is vital for correct diagnosis and individualized therapy. Combined with healthy lifestyle improvements, you may optimize your testosterone levels, enhance your physical and mental well-being, and experience a meaningful life. It's time to take responsibility of your health and restore your energy.
Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.